Assalamu alaikum. The communication day, the first scenario. Mrs. Mary, known case of diabetes for 15 years. She has been managed with insulin in the last 10 years, has been well controlled. She's on metformin, statin, and aspirin. She was admitted to the hospital 3 days ago with community-acquired pneumonia. Her condition has improved with antibiotics. Yesterday, while in the hospital, her daughter noticed the nurse is about to administer 40 units of insulin as against the usual dose, which is 14 units, and she stopped here. The daughter Anna is upset about the mistake and requests to talk to you. Your task is to talk to Anna about the incidents, provide a satisfactory explanation, and discuss measures to prevent such error in the future. Now we can start.
Hello, my name is Dr. Al-Mahdi. I am doctor in medical ward today. Can I confirm I am talking to the Mrs. Anna? Are you daughter of the Mrs. Mary?
Yes, that's me, doctor.
Mrs. Anna, we are here to discuss about your mother condition. Can you tell me what the expectation from your mother? Are you next of kin?
Yes, I am.
Can you tell me what do you know regarding your mother condition?
Okay, doctor, I'm here to just express myself, my disappointment. I'm sorry to use that word, but that is just the way I feel right now. You know, my mother has had diabetes for quite a while now, 10, 15 years, I suppose. And she has been on insulin for the past 10 years, which I administer myself at home. And not for once have I ever made an error. My mom has been on 14 international units. And to my surprise, yesterday, one of the nurses on the ward wanted to give her 15 international units, which is way too much to what she would have taken. I appreciate that she has come to you with some form of infection in the chest and she has improved, but the insulin error is just not acceptable. And I'm not quite happy about this. No, it is not acceptable, doctor. It is not. She could have died. She could have gone into low sugar, anything could have happened. No, that is not acceptable.
Yes, Mrs. Anna, I am apologize for happened to your father, happened to your mother. It is not acceptable, and is not attention. I am sorry on behalf to the medical and our medical team regarding what happened to your mother.
Sorry will not sort this. You can't just be sorry, doctor. Sorry. What if she had given her the antibiotics? Understand that it's not your fault, doctor. It's not your fault. But I just have to let you know about this. She could have something terrible could have happened yesterday. And all I will have gotten today will have been sorry. No, doctor.
Yes, I know that.
I'm not happy about this. No.
I know this hard condition for you. Please accept our apologize. Is not practical and there's not into the there's not acceptable what happened to regarding to your mother. Please accept our apologize. It was mistakenly happened. What we need to do now, the first of all, we stop the insulin and give her the dextrose give the dextrose to improve her blood sugar. And also I will write incidence report to discuss and inform the nurse, inform our consultant and the nurse and the risk management team to know why this happened and to investigate it about this.
Doctor, you mean you want to
follow me?
I'm following you, doctor, but you can't. I don't know if it's still right. I don't know. So I'm sorry to use that word anyway. That stopping insulin. Insulin has been helping her for the past 10 years, and she has been doing well. And the I don't know, the insulin was not given because fortunately I was there to stop it. She didn't have the high dose of insulin at all. But I'm just wondering if she had added by mistake at that time yesterday and something terrible could have happened. At that time, doctor, I appreciate that you want to do all those things that you said you wanted to do. But anything could have happened yesterday. Thank goodness I was there. Mommy. Doctor, I'm not satisfied with this. No.
Yes, Mrs. Anna, it was for having this. Your mother, is not acceptable, and please accept our apology.
Okay, doctor. It's all right.
What about your mother now?
Well, she should be fine. I've not seen her today, but I think she should be fine because that was not administered. The insulin was not administered yesterday. But I'm just wondering, what if?
I am really sorry regard what happened to your mother. Please accept our apologize. It was is not attended. But I will do all investigation to know what is happened, and inform our consultant about what happened to your mother.
All right, doctor. It's okay. But I think this just needs to be discussed further beyond this conversation. And I just want to know what would have happened to my mom yesterday if that insulin has been given. What would have happened, doctor? What would have happened at that point?
Yes, because the insulin, if given the insulin, may be leading to the decrease the blood sugar and leading to the symptoms such as the loss of the awareness and sweating or something like that. But fortunately, no. But this is the good news. Your mother, the insulin is stopped, and your mother is now she is okay.
It's okay, doctor. I don't have confidence in the nurses giving my mother insulin anymore. I want to give it myself. I've been doing it for the past 10 years, and I think I can do it effectively. I will come whenever insulin is due. I will administer it myself.
Yes, I will inform the head of nurse and the to what happened, and I will do the best to prevent this happen again.
Doctor, I appreciate your efforts in preventing this from happening again. But let me do what I can do. At least what I can do at this point is administer insulin to my mom myself, which I've been doing for the past 10 years. I've never for once made such an error.
I am apologize regarding that happened to my mother, your mother.
It's okay, doctor. It's all right. But
I will I will I will I will inform the nurse. I promise you, this can not happen again.
so how will you ensure this does not happen again? I just want some measures, doctor. I want some measures, some reassuring measures from your side as well.
Yes, we keep your mother under our close observation, and keep you monitor her the blood sugar all the time, and I will do the best for preventing this happen again.
So you mean you'll be coming over to see my mom every day to ensure that she's well? So I can say that you told me you will ensure that I'll be coming to see her every day. Is that what you mean, doctor?
Yeah, this when I inform the nurse about that, she is take care about her, and this is not happen again. Because, and also I inform the risk management team, inform the consultant, from these the learn all the medical staff to care about this the patient, and don't do this again.
Hey, doctor. Thank you so much, doctor. Yeah, it's okay. But I think I just need to take this further. I want to take this further. Like, I want to take this beyond this conversation. In short, I want to report this appropriately.
2 minutes left.
Mm-hmm. And also, I will write the incidents report about what happened to your mother.
It's okay.
Do you wanted me explain more about your mother condition once since admission to the hospital regarding to the bug infection?
Well, I don't know.
Okay. Do you have any other concern?
No. Just I want to make make this official. I want to report this official.
Yes, we can repair. Yes, we can refer you to the patient lysis surface. If you need to, yes, we can refer to the patient's lysis surface regarding your complaint if you wanted to complain.
Okay. Thank you, doctor.
Any other concern?
I'm okay, doctor.
Mm-hmm.
But I'm just worried that what if that insulin has been administered to my mom, doctor? What will have happened? It's just something.
Okay.
It's just a puzzle that has not been solved. I don't know.
Yes, please accept our apologize. This is not happen again. I will do the best to prevent this happen again.
Okay.
Do have any other concern?
No, doctor. Thank you.
10 seconds left. You want to ask anything? Any support, social?
Okay, can I ask you some social questions regarding your mother?
Mm-hmm.
With who you live?
She has been with me for the past 10 years, and I've been taking good care of her.
With supporting her?
Yes.
With who supporting her?
Yeah, my sibling comes around, and we are well supported.
Okay. She's smoke?
No.
She's drink alcohol?
No.
She's drive?
No.
Okay. Do you have any other concern?
No, doctor, no.
Okay.
Okay. Almost time is up. I added just 40 seconds for the last concern and the social support. Thank you, Dr. Rasha. I don't know why you are lost in this scenario. It was straightforward, but it looks like you are lost in between.
Yes.
Yeah. Okay. So I will comment after Dr. Ayula comment.
All right. Thank you. Well done. It's a good presentation. It's well, I'm quite understand from the way you approach the question. I understand that you know that it's a medical error station. Okay, but my concern, you didn't. My concern were not sorted. My concern really, if you really see that I was really adamant about, I kept saying it, that what if my mom has been given that insulin? What will have happened? I just needed that explanation. And if you have given me that explanation at that time, I possibly would not have raised the effect, the sort that I want to take it further officially. That was the first thing. What I was expecting, or possibly, let me say, what I've seen, the way I've seen this station handled has been that, okay, you apologize, that we are sorry that this has happened, and you tell me what usually is being done at that time. You apologize and you thank me. You commend my effort for being observant. I commend you for being observant in your mother's care. And when I administered special treatment like insulin that required special attention, we used trained nurses. Okay, and even at that, we double check the doses. And then after administering insulin, we monitor the patient closely, even when the usual doses are given. So if your mother has been given the high dose, we'll have still monitor her closely and pick up any possible side effect of high insulin, like low sugar, and then attend to it as soon as we can. So just something to reassure me, like, okay, even if nurse has given the insulin, we will have still been able to pick the complication and attend to it as soon as we can. That will have sort of reassure me that, okay, if I'm not there and something like this happen. And there are some use of some medical jargons in this discussion that I think I was able to see a pick. I think to talk about I don't know if incident report is a medical. I don't know if there's any way to say that, but possibly I've been thinking in my head like, okay, I will do a special report. I mean, to make it known to the organization, so that it's a way to look at what has happened, and prevent the occurrence, and see ways to prevent such occurrence in future. We'll also discuss this in our regular meeting department. That will be like the root cause analysis meeting. This has happened from the nurses side. You could also say that you would discuss with the ward manager or the ward matron, so that they can have a look into this. Just something to reassure me over and over again that this will, you ensure that this will not happen, because the task was to explain the satisfactory explanation and discuss measures to prevent such error in future. So those are just the things that I noticed. But the incident report, the root cause analysis meeting, then what's okay, you directed me to pause, which I wouldn't have gotten there if you have gotten some satisfactory explanation about everything that happened. But altogether, it was a good presentation, I must say, because you're able to pick that as a medical error. Decent report was discussed, the root cause analysis. I think you mentioned the root cause analysis, and then you were able to direct me to pause, even when it seems like I was not getting some satisfactory explanation. So it was a good presentation altogether. Well done. Thank you.
Yeah, thank you, Dr. Ayula. I agree in one concept in every scenario, particularly communication. Whenever the surrogate repeat the concern, make sure you didn't satisfied her answer. So try to find a good answer for her concern. If the concern is frequently repeated by the surrogate, means there is mistake in your answer. You have to address it or to change your answer. It's a big lesson. You have to learn from any scenario with repeated concern means there is something wrong. Okay, back to the concern. I will try to repeat this concern particularly because it's very important one. Doctor, what would happen if she received this? So the answer, I appreciate your worry. Your worry is understandable. Dr. Rasha, every day and every communication, she's fine. I don't know today what happened. Maybe you are stressed. Anyway, so your worry is understandable. And the good thing, reassure her. What happened? She discovered. So the good thing, fortunately, you discover that. However, it's not our practice to give wrong dose, mistakenly given, and it's not intentionally. Be sure about that. And and this is very important, as Dr. Ayola said. And by the way, it's one of the real life practice. Whenever you are giving insulin, you are checking blood sugar after 1 hour. So you are saying what's happening in reality. Even if she received this insulin dose, we're gonna repeat blood sugar monitoring every now and then, after 30 minutes, after 1 hour, and observing her symptoms. And we are taking care of these signs of hypoglycemia in every patient receiving insulin. And always there is alarm beside the bed. There is button. Whenever the patient, we are educating the patient, if she feel like she's not fine, she can alarm or press this button in order to prevent such event. Okay, so reassure her. She's worried. She might be in hypoglycemia, but we will discover it sooner or later. This is regarding the first concern, and I think Dr. Rasha couldn't understand. That's why she didn't, and she skipped it. The other concern, and also Dr. Rasha didn't answer, which is also a new concern in the meeting Dr. Ayula raised. I would like to give her the insulin myself. So what do you think, Dr. Rasha? Would you allow her to give the insulin to her mother in the
Yeah.
hospital?
No, it shouldn't be allowed.
Yes, it's not allowed. You didn't address this concern. You can't say, I'm so sorry. I appreciate your worry about your mother. I know you are taking care of her at home, but it's our job here. And be sure this mistake will not be repeated again without promise. By the way, don't say, I promise you. Why? Because you don't have any guarantee. You might go and leave the hospital, and next shift, the mistake will be repeated. You don't know. It's not your mistake. It's not your fault. But the mistakes happened. So the best thing not to promise. Don't promise any surrogate or any patient. You don't have any guarantee. The mistakes happening even after discovering them. It might be recur back, right? The other thing, you are not allowing any family to give any medication at hospital. Why? Because she might have some emotional issue. She might miss the dose. She might give wrong dose. But if you, in hospital, you are the one taking care to give and to administer the correct and accurate dose. Even it was given mistakenly, we will correct this. We will report. We will do the action for the mistakes, but you will not allow the family member to give the medication. Okay, be sure about this in any scenario. Don't allow. Back to the introduction, you ask good question. You introduce yourself. You ask the next of kin, the background of the mother, the expectation. All this thing went good, but when you come to the mistake, you didn't address it well, and you mentioned that you give the dextrose, and the patient already discovered that she was about to take the insulin, not taken already. So why you are giving her the dextrose? And you can say glucose better than dextrose, okay? So we give her glucose in order to correct. But in this scenario, it wasn't. So the lesson from this mistake, the scenarios and bases are repeated. I agree 100%. But sometimes they are changing the sentences. So don't put a plan to give or to drive the scenario as the scenario you already practiced before. Okay, this is a very important lesson. Why? Because they are changing from diet to diet, from center to center. They are changing the words, the sentences. Even one word, it can change the event, and you might address it wrongly. As in this scenario, it was about to be receiving the insulin and it was discovered. So no hypoglycemia, no complication happened. It was like what's we called in medicine near miss, means that the patient was about. It didn't happen. That's why it's called near miss mistake or event. You will do incident report. You inform the nurse supervisor, the head nurse. You have to do the root cause analysis to analyze why this happened. Was the nurse disoriented, or was she confused, or was she not concentrating in the dose? You have to know why this happened, and you can tell her we will try our best to improve our service and quality of service to your mother and others. All the mistakes happen to improve the service and to prevent this mistake from happening again. And please apologize every time and assure her that this mistake is not usually happen. And once it happen, we take it serious and we'll try to correct it immediately. We already take the action. Don't mention what action, what medical action here, because nothing happened. But if she address or she ask you, doctor, what if she receive it? What will happen? Yeah, we will discover it sooner or later because we are monitoring her blood sugar hourly or even less than hourly, sometimes half hourly. We are checking blood sugar, right? And this is the practice, real practice. So these are the concerns and the scenario. It's a mistake, medical error, straightforward scenario. You have to apologize. You have to do the steps, informing the consultant, the nurse supervisor, root cause analysis, and the medical action. In this scenario, the medical action, we monitor the blood sugar, and we try to correct this. We write it in the folder, for example, in the report, in order not to be repeated again for your mother and other patient. But nothing serious happened. But our action was serious against the event itself. Okay. The social, I don't know why also you were lost. 2 minutes left, and you are asking about do you want me to explain about your mother? She doesn't want all these things. She need from you to support her, to be sympathetic and empathetic with her. Now the time for social support. With whom your mother living? Does she need any support at home? How she cope with her life and daily activity? Who's giving her the medication? All the things you can address. Even the smoking and alcohol. Okay, I agree to ask them. But if she said yes, she's drinking alcohol, what you would do, Dr. Rasha? She is smoking, so what you will do? You're not talking to the patient.
Mhm. Yes.
Yeah, so what you will say?
Not need to ask about.
Okay, if you ask about and she is, for example, you did it, okay, and she
Yes,
is
I will arrange other meeting to discuss about
exactly,
your
yeah,
mother regarding this alcohol and smoke.
mother,
Mhm.
with the mother, not with the
Yes.
dates. Yeah, we will
Yes.
sit with your mother to inform her about the hazards or the risk of alcohol on her blood sugar, on her general health, the smoking. So it's not important to ask, but if you ask and you discover that, you can address it with the mother, not with the daughter. Okay, but the support here is more important than the smoking and alcohol. So you can ask for the social support, the job itself, the driving, which is good also. Let she drive because you want to arrange driver for her, for example, while going back to the home. And who's sitting with her, taking care of her is very important. Who's giving her the medication? Because this mother might need a close observation at home after she would be discharged. Clear now?
Yes, clear.
Okay. Next time I will let you start second because whenever you are doing second candidate, you are doing perfect. I don't know, maybe because you are started, you are not ready to start. Maybe that's why you were confused. Okay, I will read for you the scenario, Dr. Ayula. Mrs. Noha, new diagnosed SLE by nephrologist, and the nephrologist decided to do renal biopsy. Discuss with her about the diagnosis and address about pregnancy. Suppose not to write the pregnancy and let her think. What the age of this patient, Dr. Rasha? 30?
35.
35. Okay. Dr. Ayula, I will read the comment till you will be ready, okay?
Okay, all right. I'll tell you when I just want to read the question again, okay?
Okay. The comment, Dr. Ilaf. Why dextrose patient didn't have the insulin dose? Daughter stopped giving insulin. Yes, exactly. We mentioned this. Yeah, Dr. Rasha, this could also advice. Don't say I, because you are one of the team. There is also one concern here in this scenario. Can you give me the name of the nurse? I want to have a complaint or to complain against her. Okay. Yeah, one of the concern also, I wanted you to address it fast. She told you, doctor, I'm not satisfied with your steps. Immediately, refer her to the office. She want to hear that. She want to hear you that you are supporting her. I agree with you. It's your right. If you want to complain, it's your right. Because she needs to complain, and she want to say, I would complain. Either to ask her what other steps you want to do. We are here to support you. That time she will tell you, doctor, I want to complain. Then you can say the name of the office, patient advice nursing services. I will guide you to that office. They will help you and they can assess your concern, okay, or your problem. They can assess your complaint or your problem. The Yeah, so we can say we, don't say I. You are part of the team, agree, and you're not working alone in this problem. In case of medical error, can we say risk management team or it is a jargon? I believe risk management team, not in this scenario. Risk management team in something might happen. But here in this scenario, it's already happened. So that the assigned team for this scenario, root cause analysis. Okay? The risk management team, for example, patient admitted and you are worried about something might happen. So you're gonna inform this team to take care of the patient. Okay, no role for the risk management team in the medical error. There is, yes, Dr. Maida, the incident report already done, I agree. So no need to raise or to say, I would like to do an incident report because it's already addressed or already made. Ward manager involved. Yeah, the nursing supervisor or the ward manager or head nurse, anyone superior to this nurse should be involved. Dr. Maida, again, I don't know why we ask about smoking. We already discussed this issue. Thank you, Dr. Maida. Dr. Sahura or Shura. I don't know how to pronounce Sahura or Shura. Anyway, I have same scenario last night in Cairo, but the patient was insisting to give himself his insulin and I can't convince him. Yes, good to know. Thank you, Dr. About this concern. So it appeared recently. So you might have this concern in your next exam. So the best answer, and this is again, this is the real practice. You are not allowing let the family give any medication to the patient. If there is some social issue with the patient, between the patient and the relative, she might either emotionally, for example, she will forget, she might emotionally miss the dose, or she might by force give the patient medication. Anything might happen, so it would be your responsibility. Why you let her give the medication? Instead of that, you have to give or to do the all care in the hospital by our team, the nurse and our respiratory therapist, according to the care would be provided. At home, the family are responsible for anything will be provided to the patient. But at hospital, it's not allowed. They can help you, but they cannot taking care of this thing. Okay. So yeah, they can help you while giving her the water, giving her the meal, feeding the mother. Even sometimes we're not allowing them to feed the mother or the patient. The patient might have shocking and you'd be in trouble. Why you let her or the family give her food? So whenever the patient is still in the hospital, he is or she is under our responsibilities. When he will be or she will be discharged, the family would be responsible and they will take care and look after her. Clear? Thank you, Dr. Sahura or Shura. I cannot know the pronouns of this name. I think Shura, maybe Dr. Shura. Okay. Are you ready, Dr. Ayula?
Yes, I am.
Okay. Here you go.
Hello, I'm Dr. Ayola. I'm one of the doctors here today. Can I confirm you are Mrs. Noah?
Yes,
35 years, right?
yes, I am.
All right. Mrs. Nora, we are here today to discuss an update about your health. Is it okay to go ahead today?
Yes, doctor.
All right. Before we proceed, could you tell me what you understand? What knowledge do you have about your current health?
Yes, doctor. Recently, I have some joint pain and also rash in my face. The doctor to discuss with me to do some investigation, some testing. I want to know what the result of these the test.
Okay, all right. We are here today to discuss this test. I'll discuss this test result with you, and then discuss the further plan that we have with you. Okay. So
Yes, doctor.
the tests that you have done previously, which include the blood and some other tests, okay, have shown that you are likely to have a condition that is called systemic lupus erythematosus. That is simply SLE. Have you heard about that before, Mrs. Hara?
No, doctor.
Okay. Is it okay that we discuss this today to tell you more about it?
Yes, doctor.
Okay. All right. So systemic lupus erythematosus is simply, I know it is a big word, but don't worry about that. I'll explain it to you. It's a serious condition, and it's a condition that affects different systems and organs in the body. And it's because of disturbance in the defense system in the body that normally fight against some virus, bacteria, and foreign bodies in the body. But in your own case, they have started to fight against the organs. And that is why you are having the joint pain that you said you have, the rashes on your face. They can also affect other organs like the heart and the kidney. And I'm sorry to tell you that it's actually a serious condition that needs us to manage it actively. I'm sorry that I have to deliver this news to you, Mrs. Noha.
Yes, doctor. You mean, doctor, there's no any treatment for me?
Well, there are a couple of treatment that we can do, but because at this point, the further test that we also did shows that it has likely affected, like I said, affected multiple organs, and it also affected your kidneys. So the specialists in managing kidney, that's the nephrology, the specialist in managing kidney, have also has put his own input in this management, your management, I mean, and has suggested that for us to have a active planning of you, for you, I mean, management plan for you, and also to be able to put you in what level, because there's different level, I mean, stages of this condition that would determine the plan, the management. We need to do a skin snip for you. That is taking a little part of your kidney, tissue of your kidney, to look at it under the microscope, and this will further help us in making adequate plan in your management, Mrs. Noah.
No, doctor. I can't do this, doctor.
I know I quite acknowledge your feeling at this point. And may I know why you don't want to do this, Mrs. Noah? Have you heard about this before?
No, doctor. No, doctor, because I am afraid, doctor. I can't do like this, doctor.
It's Dr. Noah, Mrs. Noah, it's really okay to express these feelings and to be anxious about procedure, especially when it takes us to come in taking tissue from you. But do you mind if I explain this procedure to you? Possibly, if I have another perspective about this. Do you mind if I explain this to you, Mrs. Noah?
Yes, doctor.
Okay, so skin snip is basically a procedure that is done to take a little tissue, just it's small tissue from the kidney, to look under the microscope. It's usually a day procedure that you come into the hospital. We assess you prior to this period. We do some blood tests for you to check your blood, to see, also to check every other things that may hinder us from doing this procedure, like the level at which your blood clots. Okay, so when you come in, you'll be assessed on that day as well. Check your blood pressure and the like, to your blood pressure, I mean, and ensure that you are much comfortable. You'll be well supported by the specialist nurses. Okay, and then it's a procedure that is done while lying down on your chest. It's done from the back, and it's done by experts in this field. They do it by using a special needle to take a small sample of from your back. Not to worry. We will try as much as possible. You'll be given some medication around your back to numb this area, and also some painkillers to relieve you of it. And after this sample has been taken, you'll be well monitored for some hours before to ensure that your vital signs are okay and you are not in any pain before you are being discharged. We'll give you some painkillers as well, and then we will take the sample to the laboratory to assess for it. Do you follow me, Mrs. Noah?
Yes, doctor. Doctor, for how long staying to the hospital? Can I go on the same day?
Well, sometimes you may have to stay in the hospital. I'm afraid you may have to stay in the hospital for about 24 hours after the procedure, just to make sure that everything is all right. Is it something you can do, Mrs. Nora?
Yes, doctor, because I have a work.
Work, okay, not to worry. We could give you some if we could give you some usually when you could do some self declaration self declaration for about 7 days of work. So but if you need our support, we could give you some documents, some letters to support this, and also give you some sick leave if it is needed. Mrs. Nora.
Yes,
How does
doctor.
that sound?
Doctor, there's yes, any complication?
Yes, we are going. Going to go that into that. Well, for this procedure, there's some advantages that it has, and also some complication that may arise. The advantage is that it will make us to know the stage of the kidney of your kidney condition, which will help us to do further planning of your treatment, and further planning of your treatment. But however, a side effect could include that you could feel some pain at the back for some time. We will give you some painkillers for this. Also, you could have some swelling um at the back as well, and also sometimes you may also bleed into the back. But these complications are not common because there's a team of experts that does this, and we also closely monitor you to ensure that this does not happen. And if it does, there are measures to support you and also to assess you as fast as we can, Mrs. Noah. Is it something you are considering to do?
Yes, doctor. If doctor, I'm not do this procedure, what happen? Can give me a medication?
Um, I know it's a lot of it's a difficult conversation to make, and but unfortunately, Mrs. Noah, at this point, I'm not. We are not able to because we are not able to start treatment if we don't do this investigation, because it's the ultimate in making this diagnosis, and also it help us to make adequate planning of your treatment, because there are different stage, like I said earlier, and different stage requires different treatment. So this is important in making your diagnosis.
2 minutes left.
Is it something you want to do? Do you consider doing this?
Yes, doctor, because doctor, I am planning for a pregnancy in the next month.
Oh, okay. That's good to know at this time that you are planning your pregnancy, being a young woman. But if you want to get, I would advise at this point, if you want to get pregnant, I would suggest that we speak to the woman doctor, because pregnancy in your situation in people that have this kind of diseases could come with a lot of complications that need adequate planning, adequate support from women doctor. And at this point, I would suggest we can adequate planning from the women doctor. So if you want to stop, oftentimes we advise that during the active phase like this will delay pregnancy, but this conversation will be best have with the woman doctor, who will refer you to them, and then you can have a conversation with them. And then if you want to get pregnant, we need to plan this pregnancy.
You mean doctor? Yes, you mean can affected in the pregnancy this disease?
Yes, it can affect. It can the complication. You can get pregnant, but the complication, decide if the complication the risk attached to this pregnancy is higher than people who does not have this disease. So it's best that we plan the pregnancy and you are actively monitored by the woman doctor. How does that sound to you, Mrs. Noah?
Yes, doctor.
Okay. Do you think we can go ahead to take the consent for the procedure today? Is this something you want to do?
Doctor, can I give me time to thinking about that?
It's okay if you want to have time. We will give you time. I'll give you some materials about this, some leaflets and some websites that could be beneficial to make an informed decision in our next appointment. Would that be would that be okay?
Yes, doctor.
Okay, just a few questions about you. Mr. and Mrs. Noah, do you smoke?
No,
Do you take alcohol?
no.
All right, and who do you live with?
With my family.
Are they supportive?
Yes,
All right, good to know about that. And what do you do for a job?
I'm a teacher.
And how has this affected you in any way?
Yes, doctor.
Okay, how could you tell me?
Yes, it's affected me, doctor, because I have the joint pain.
Okay, all right. So we could refer to the occupational health so that they could have a discussion with you and see a best way to do some adjustment to your work. Is that okay?
Yes, doctor. Thank you.
Thank you. Have you got any other concern today?
Yes, doctor.
Okay, time is up. Thank you, Dr. Ayula. Well done. Dr. Rasha, please, can you comment first? Then I will comment.
Yes, well done. Explanation of the disease. Then after that, talk about the procedure before and after and during and complication. And then address the patient concern if you not do the test. Yes, to start this treatment. And also address her concern regarding the pregnancy. I think, yes, she is well done.
Yeah, thank you, Dr. Rasha. Well done. I agree with you, but if we can add only staging or, as she said, accurate diagnosis, but we can say staging. We have to know the stage of the disease on the liver. So you can't simply say it. Why you want to do the renal biopsy, adding to the indication of the medication to give the correct and accurate medication, and to know the stage of your kidney affection in this disease, because mostly we have some stages and we have to know at what stage you are, and accordingly we will give you the medication. Okay, this is regarding the hesitance to do the test. You have to address it more, and you address already why she's afraid, and if she's concerning about any point, you can solve it, either pain or complication, and the important seriousness of the doing the test, or the serious hazard if the test is not done. It might worse again, and the kidney might worse more, and you might have more complication. This, yeah, as any procedure, you have to say before and to try to mention blood thinning medication. Those patients, particularly SLE, they might have antiphospholipid syndrome, so they might have on anticoagulant. So you can ask even once, or you can say as a preparation type of one of the preparation, we have to know that you are not on any blood thinner medication, and your blood test and workup is okay, and fine to do this snip from your back. Then the steps of admitting you, and the day of the procedure, you will be admitted to the ward or the uh, procedure room, and we will clean the area by small needle. We're gonna go guided by the scan and try to draw, Dr. Ayola.
Okay.
Yeah, it's very important to draw. At least you can draw the back, the needle going back and through the back, and with the scan, guided by the scan, and that's it. After and the complication, you mentioned already the bleeding, the swelling, but you didn't mention this, the injury. You might injure. So two eye, two P's. Always I'm saying two eye, two P's. The P, the first P, pain, and the other B is bleeding. Eye, injury, injury to any nearby organs, or injury, or I think I missed the other one, injury, or
Infection, bleeding,
yeah,
injury.
infection. Yes, infection.
Yeah,
Yes,
infection.
yes.
Yeah.
Yeah, there is some, but not in your condition. So by cleaning the area, the infection rate would be low. Adding to this, we have expert team. They are many times doing this procedure, and they are experts in this procedure. They are well skilled, and they know how to do it without complication. Although every procedure have the risk of any complication. The red flag in this scenario is very important. Okay, you might have some pain, and for that we will monitor you. We give you painkiller. You might have some bleeding in your water work, and it would be like safety netting. Please, if you feel the blood is profuse or excessive, don't hesitate to call us at any time. Okay, the safety netting after this procedure is very important. So the pain, any feeling unwell, or any excessive bleeding through your back, through your water work, right? It might happen. It could be in a small amount, and this is expected. But if it was excessive amount of blood through the urine, she might be at risk to have injury inside. So she should visit the GP or even the hospital. So you have to give her some safety netting before leaving the hospital. The consent form here is very important, as you mentioned. And if she's hesitant, you can tell her, take the consent, read it carefully. It would be explaining everything. And whenever you are ready, let us know. And you have the right at any time to withdraw if you will. Okay. Then I think the closure, yes, the social here is very important. Smoking, alcohol, and the pregnancy. You addressed the pregnancy, but you didn't tell her that the condition should be controlled before the pregnancy. Yes, I agree to refer her to the woman doctor, and this is very important. Should be planned pregnancy. But why I should be under planned pregnancy with the woman doctor? Why? What the rationale of that? You remember? In
Drug.
comparison, multiple sclerosis and systemic lupus. One disease improve with pregnancy and the other with worse with the,
Bossing.
so what increase or what worse with the pregnancy and what to improve with the pregnancy as a symptoms? Dr. Ayula.
Okay, for SLE, it worsen.
Exactly.
Multiple sclerosis improve.
Exactly. However, after the improvement during pregnancy, after delivery, the multiple sclerosis might flare up again.
Yeah.
So in SLE, in order to have planned and safe pregnancy, you should control the disease first. Why? Because whenever you have pregnancy, the flare up is commonly happened. That's why we should diagnose you first, start medication, and postpone your pregnancy. And it should be planned with your woman doctor because you are going to take many medication to control your disease. And most of this medication might be harmful on your baby. That's why it should be planned after controlling the disease. Clear now?
Mm.
Yeah.
Yes.
But otherwise, in general, you can get good marks in this scenario by your discussion. So you know how to put scheme, but add to your scheme drawing only. If you draw, it much be better for you and for the surrogate himself or
Mhm.
herself. Okay?
Okay.
Okay. Thank you, Dr. Ayola. Any question?
Yes, and also
No.
can add arrange other meeting after the result of the
Yes.
SNP to discuss
Okay.
about the result.
Yes, exactly. Yes, you're right.
Mhm.
And always keep asking Dr. Ayula, what's your opinion so far? Because she was refusing, and after I explained some of the steps, I should have her opinion, right? How do you see? How do you think? How does that sound for you? Is it okay for you? Okay. It's like
Okay.
verbal consent, but it's not enough. You have to have written consent for any procedure.
Mm.
Clear?
Yes.
Yeah, okay. Any question, Dr. Rasha, Dr. Ayula?
No
No.
question.
Perfect. Okay, any discussion point to be raised by others? SLE words, yes, Dr. Elaf, thank you. Anyone want to raise any concern, want to ask any question, any doubt, any suggestion? Clear for all?
Yes, just about the first scenario.
Yeah.
Okay, I just want to make about the patient relative administering the insulin. I'm just thinking, I don't know, that this administration of insulin, can since the patient as a way of supporting the relative, can this be done under supervision? Like, okay, because you choose to want to do it yourself, we will allow you do. You've been doing it with the patient at home, and she knows how to do it. She can
Okay. What?
will allow you to do it, but in the presence of a nurse. There will be a nurse with you at every time you have to. But she's been doing it. She's been trained, or she already knows how to do it. She's been doing it for 10 years.
Okay. Yeah, I
Just
will. Yeah, I will tell you. If this is the first time for the patient and you want to educate her, so you can tell her, yes, I would educate you. But if she knows and she want to do, no, please, this is our job today or our job in the hospital. I don't think it would be accepted to do under supervision. I'm not sure as well, but at hospital, anything should be done by the nurses. This is what I know. Yes, you can take care of your mother whenever your mother with you at home, and we will be sure that you are doing this properly. So, if you want me to educate you as from the nurse to the family member, we can tell her I will teach you how to do it. But to do it under my supervision, I'm not sure as well. I don't want to be restricting that, but as well as I know, any medication to be given by the nurse. Even the food, sometimes we are not allowing the family to give the food, particularly if the patient is having choking attacks. But if someone have evidence about that, the nurse or the family member can give medication under supervision. Okay, we can share it together. If you have this evidence, please share it with me or in the WhatsApp group.
Mhm.
Okay, Dr. Ayla. But in paces wise, it's okay. We will take care of this and we will give her the medication. Don't worry. We'll be sure that the dose will be accurate and correct. The mistake, usually, it's not happening in our hospital. We are taking care of this and we'll try not to have this mistake again. So we'll prevent this happening again. Okay?
Mm. Yeah.
Yeah, makes sense?
Yeah, he does.
Okay.
Yes, but I have questions regarding the previous scenario.
Yes, sure, Doctor.
Regarding this the scenario, the deal with the medical error or not?
Yeah, of course, medical error.
But the patient stopped the insulin.
Yes, it's called near miss. Means that it was about to be given, but it was prevented.
Is not happen. You
Pre-
mean the side
yes, yeah,
hard bad
it's
effect is not happen.
yes. There is three types of mistake in hospital. The near miss, which is about to be happened but already discovered. The medical error, which is already happened, we discover, and it's not something fatal. And there is also something fatal mistake. I'm not sure about the name, but fatal mistake happened. So the patient already have the error and it harm him. I think in major way. I'm not sure about the name of each one. Anyone in the administration or having any practice about that? Any experience
You
about
mean
the mistakes?
this patient the bad effect is not happen, yes, but the patient
Yes,
because stop the insulin.
yes, exactly. But still,
Okay,
it's considered as a medical error.
medical error.
Yeah.
You mean inform the nurse and consulted and
Yes,
waiting.
should be. Yes.
Mm. But what is the clinical clinical
Yeah. Action. The medical
regarding this
action here. The medical action here is monitoring blood sugar
mm, okay.
because you didn't give. Maybe the blood sugar will be higher. Maybe the next dose will be low. You don't know what will happen, so you will monitor blood sugar, and according to the reading, you will give the correct dose because you will not give this dose, for example, or you will correct the dose. And the other action should be informing the supervisor, to have an action with this nurse, to sit with her. Is it okay? If she has any social issue, if she has any family issue, why she's not in her mood, why she did this mistakes. Okay.
Mm-hmm.
And the other thing that maybe the doctor who write down the dose, he did that wrongly, because sometimes when the patient say for you 40 and 14, sometimes you get it wrong, so you write it down. So it needs to be like extensive investigation, looking at the drug chart, why this happened, and if it is right correctly,
Yeah.
why the nurse did that. So
You
yeah,
mean in the file? Yes. Okay. Yeah. Could be. Yes. Thank you, Dr. Awatif. Right, Dr. Awatif?
Dr. Ala.
Dr. Ala, thank you. Any other doubts or suggestion from others?
Can I just double check regarding the SLE scenario? Should we
Yeah.
discuss about the management and the side effect of the management or not in this case?
Management, no, it's not the task here.
Okay.
And you don't have time to explain the management plan.
All
It would
right.
be in another scenario. Your scenario here is renal biopsy as a procedure. The procedure, it will take at least 5 minutes explaining the preparation and the procedure itself and the complication and the consent form. The other
All right.
5 minutes, you will ask about the background, the expectation, the introduction, and the social support and the pregnancy. No time at all to raise the management options. In
All
another
right.
scenario, you will have SLE as options of medical, for example, management or pharmacological management or non-pharmacological management, whatever. But it's not in this scenario.
Okay.
Okay,
And
that's all.
another question is that regarding the history, should we take it, initially or after at the end?
No, 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 no history taking at the communication at all. What you are asking to know how much the patient knows about her condition. It's not taking history. So,
No, not checking the understanding. I mean, like
uh,
regarding, the pregnancies, the smoking, and alcohol and all that
yeah,
stuff.
yeah, at the end, at the end.
At the end, thank you.
You mean social history? Yes, yes, okay.
Social history.
Yeah, at the end, after finishing the task, if you
Okay.
start doing these social issues and this matters and you didn't do the task, you will be in trouble.
Okay.
So as soon as possible, start your task. You finish the introduction. You want me to explain about the disease? No, doctor. So we are here to discuss about the renal biopsy or a procedure called renal biopsy. By the way, SLE, I agree to mention it as breaking bad news. It's one of the medical condition with the frequent relapse, flare up, and frequent complication might end up with renal failure and sometimes lung disease, interstitial lung disease, joint problem. So it's one of the breaking bad news condition. For me, I will explain it as breaking bad news. You have a
Okay.
condition called SLE. Have you ever heard about that? No, doctor. You want me to explain? No, doctor. I know about it. You know more about it, or you want me? Please, doctor, give me summary. You can give her, as Dr. Ayula said, defense system misdirection in order. Instead of attacking the bugs, it's attacking your body. In 1 minute, try to
Mm,
finish this and the renal biopsy task as a task. At the
okay.
end, social and pregnancy and the job. Occupational.
All right. Thank you.
Most welcome, doctor. Anyone with any question? Okay, there is some message. Okay. Can I ask some question, Dr. Ilaf? Some questions in the communication in general, not in this scenario. I couldn't get this. What you mean by these questions? What type of question you are? What type of question you are talking about, Dr. Ilaf? Okay. I think maybe Dr. Ilaf left or she's writing. Yeah, in our in DNR. Yeah, you mean question in general? Yes, okay. Yes, of course. Any communication day, you can ask any communication issue. In the DNR, if the team of doctors decided that the DNR is the best interest of the patient according to his condition, but the patient is refusing this decision and ask for resuscitation if cardiac arrest happens to him, what is the best here? To follow the doctor decision or to do as the patient wish? Okay, good question. So the patient have the right to share and to know and to decide, but not against the medical condition. Here is not an option. This is medical decision and the best interest of the patient. So it's not as option to have opinion. Okay, the medication he can refuse, but he cannot select or he cannot choose. Please do for me CPR. No, you can refuse, but you cannot request. This is what I want to say. So you can refuse, but you cannot request. Okay, clear, Dr. Ilaf? Particularly DNR. DNR is a medical decision. Should inform the patient. If he refuses, you can call the social worker. You can have a meeting with him, another meeting with consultant till the end, but he cannot refuse it. Good question. Thank you, Dr. Ilaf.
But doctor, in case like, because sometimes the consultant, when the consultant start to discuss this DNR with the patient, and the patient said, I would like to go for the I would like to go for DNR, or I would like to discuss this with my family. So what happens usually, the consultant will not sign it immediately. So he will say it's okay. I will have another discussion with you, or it's okay. You can have your time with your family. You can do your discussion with your family, and we can,
Yes.
yeah, come again to discuss this. In case if cardiac arrest happen
Yes.
while, and there is no documentation, like there is no DNR form in the file of
Yeah,
the patient, shall we go for the,
exactly.
and because on-call doctors will come and there will not be like any DNR in
Exactly.
the form of the.
Yes. Yes. And we are facing such issue and such problem in our real practice. The family is refusing and they are even attacking you. If you will not support my father, I will complain. If you have any legal debate with the family, don't do. And but it is in the practical life, okay? In basis wise, either a patient accepted or still hesitant, so you can arrange another meeting, but the decision already taken. It will not be changed. In the practical wise, you will do the CPR, by the way. Till the end, if no DNR signed, you have to do CPR. Okay? You're right, doctor. This is in real life. And you cannot sign the paper unless the patient is convinced and or the family are convinced. If they have any issue and they are complaining, they have some issue, so you can postpone it until you can do the other meeting to convince them, call the social worker until convincing the family, the patient will be active. Okay, is it clear? But in basis it will not come like this. So you have another meeting with the consultant, to arrange another meeting with the consultant to sit with them.
Okay.
But
Yes,
the
yes.
option or the request, no, don't be as DNR. No, it cannot be.
It is a medical decision. Yes.
Yeah,
Okay.
medical
So,
decision.
okay. Thank you, doctor.
Yeah, most welcome. Dr. Ilaf again. In DNR, I think this is the first. Yes, the second comment. In advanced lung disease scenario, advanced COPD or end stage liver disease, interstitial lung disease, should we ask about smoking and advice for smoking cessation or no need, as the patient at the end of his life, and better not to prevent anything for him? Yes, take it as a rule. Patient for palliative, you can't discuss anything. Palliative therapy, still the patient can live longer. Sometimes patient with cancer, for example, live for years and he has cancer. But end of life care, You cannot discuss anything. Maybe at the end of the meeting, the patient will die. End of life care, you are removing a lot of medication. You are withdrawing the management plan, the active management plan. You are stopping antibiotics even. So you are going to talk about smoking? Of course, no. It's not the time to talk about smoking in the end of life care. In the palliative, yes, you can talk about smoking. Why? Because the patient life already shortened by the cancer. So no need to be shortened more than expected by the smoking. Clear? Okay, I hope it's
Not
clear for.
stop. Keep the patient smoking.
No, stop smoking. Advise him about smoking. Ask him to stop smoking in the palliative. But in the end of life,
Yes, end of life, you mean.
whatever, either he will smoke, if he will not, he will die. So no benefit to ask or to talk about it with him. But in the palliative
And
therapy,
also in palliative, in very bad prognosis diseases like motor neuron disease or
yeah,
like
something is
also
progressive, you mean? Yes,
pancreatic cancer.
no need.
Yes,
No need.
something very progressive and very bad prognosis.
Advanced.
يعني you will
Yes.
expect months of life.
So what you mean, months of life?
Some sort of wise. If this patient like pancreatic cancer metastasize, you will not to speak about smoking, even if it is palliative. And also motor neuron disease. You think this patient will live for months. So not wise also to advise about smoking.
If
I,
the scenario is clear, Dr. Aisha, if the scenario is clear, he's in advanced stages and he's in the end stage, yes, I
but
am agree with you. But some
because you
cancers,
mentioned this end of life care, this
okay,
scenario and this scenario,
yes,
you
okay,
should be wise if you found this patient having months only in life. Because end
okay,
of life care, it is days.
okay. Let's talk about lung cancer, for example. One of the cancers still diagnosed, and the patient might be undergoing chemo radiotherapy. You have a chance to ask him to stop smoking, right? This is my
Yes,
opinion.
yes, yes, yes.
Yeah, I'm
I just
talking.
I adding for your
Yes, you're right.
talk about the
Yes,
end of
if
life
you
care and
have,
also the very bad prognosis
yes, I
diseases
agree.
or
Yes,
scenarios.
yes,
Yes,
yes, I agree. If there is advanced cancer or advanced stage liver or lung cirrhosis, for example, or lung fibrosis, he's on oxygen and he's even with palliative, but he's in advanced stage, okay, he will die definitely. So let him enjoy his life or his last moment of his life. Okay, and Dr. Ilaf, another question. Advanced lung disease scenario, okay, the patient to end of life care, better not to prevent anything. Yes, this is what we discussed now. And another scenario, Dr. Ilaf, in organ donation, did the family has the right to agree or refuse about it if there is no advance directive and lasting power of attorney? If agree, should they sign a consent? Okay, we discussed this in organ donation scenarios many times. Whenever you have patient already candidate for donation and he wrote a card or he already give advance directive or he decided earlier for it, what you want to do is to convince the family he's agree for that till the end. If the family convinced, that's okay and great. If not convinced, you have to respect their emotions. You cannot cut his body because they are because they are still refusing. So you cannot do that while they are refusing. If you could convince them, it would be great. And use the weapon of the advance directive, for example, or the card the patient used. Try to convince them by any way. But at the end, you have to have consent. Why? You have to respect their emotions. Okay, even verbal consent. If they agree, proceed. Let's talk about the other issue. If the patient himself didn't write or decided for that, so this is the decision of family 100%. They have to decide. Okay, if they refuse, you cannot do the donation. If they accept, have a consent, written consent. This is the difference between both scenarios. So if he is agreed in advance, try to convince the family using the weapon of the family. The patient himself is accepted, but at the end, still they have the right or the acceptance to do it, respecting the emotional matter of the family. Okay. If no
You mean
card,
mm,
go. Say.
yes, if patient have card, you
Okay.
needed also to convince the family.
Yes, respecting the emotions only. Because this is their father, at the end, they will take his body. You cannot give them his body with incisions or already harvested, with organs
What if the
taken.
family refuse?
Refuse, no, don't do it. But you have to
Even the
do
patient have a card.
many meetings, Dr. Rasha. You have to
Mhm.
arrange many meetings, and you are not the one sitting with them. The organ donation team, they can sit with them, convincing them many times. But at the end, they should accept it. Why? Because you cannot cut the body, and they are not accepting that. Even you can ask the legal advisor team to arrange or to have a sitting with them, but they have to accept. Don't say, I have a card and the patient already accepted. What about his family? They will take this body after you harvest the organs. So you have to have them their acceptance,
Yes,
respecting
they
them.
consider it as inherited. That what it means. That يعني patient
The,
will
the
be
dead body,
يورثوا البادي نفسه. Yes.
exactly. They will take his body. How they can get the body without organs? And if you do that without their acceptance, they can complain against the hospital. So at least have a acceptance. If they did it, if they didn't, after many trials, after legal advisor, after everything, this is their wish at the end. We should respect their wishes. Even the patient already in advance put a card or wrote advance directive. But the scenarios and basis will not be in this debate. It would be clear. Talk about donation and try to convince the family, or talk about the issue with the family. That's it. You will not be arguing the patient family and to convince them many times. If they refuse in basis wise, by the way, you don't have the time to sit and to talk all these things. If they refuse, arrange a meeting with the consultant or the organ donation team. Even if they accept, you will not go to talk about the organ donation issue or the procedure. You will refer them to the organ donation team to sit with them. So either yes or no. Yes, okay, refer. No, I will arrange a meeting with the team to sit with you or the consultant to sit with you. That's it. Okay? In paces, don't force anyone or don't use the way of forcing someone to do it or to do something. Try to convince. If no, thank you, I appreciate your worry, and refer him to consultant, refer him to the meeting or to another meeting, or refer him to the assigned team. That's it. Okay, but if no card, no advance directive, Dr. Elaf, if no card, this is the family decision from A to Z. They should accept. If not, it's not accepted. But the card as a weapon to convince them, but it's not an acceptance. Okay, it's something you can use it to convince the family, but they will should accept also the procedure emotionally again. But if no card, so it's from A to Z their decision. They should sign a written consent. Hopefully, I answer all your address, Dr. Iraf. Is it clear, or are they clear, all of them?
Yes, you meaning if the patient have a card, if, or if not have a card, you must convince the family. If the family
Yes.
refuse, okay.
If the family refuse with no card, family refused with no cards, it's their issue and this is their decision. If there is card, try to convince them many times because there is card.
Yes, Yes, but if the family refuse, okay خلاص معناها no
Yes,
need.
in both scenarios. If the family refused in both scenarios, you will not proceed.
Yes, is not proceed. Yes. Okay.
Okay.
Clear. Yes,
But
clear.
in favor of the patient card, you can convince them. But if no card, means you cannot do anything.
Yes, you mean use the card as the weapon.
Exactly.
Okay.
Clear. Thank you, Dr. Rasha. Thank you, Dr. Ilaf. Any other questions? Any doubt? By the way, any doubt in communication scenario, as Dr. Ilaf did, you can raise it at the end of any meeting. And you can go back to the sessions, previous sessions, you can have the same opinion. From the start, we are practicing in the same based opinion. So try to go back to the videos, you can hear all these opinions and the sessions. Any doubts before ending the session? Okay, the last question from me now. Would you like to do this week as long and communication, or you want to do it with a short? Okay, based on the
Yes, short.
short,
Mhm.
okay, so tomorrow will be short. This week will be for the short, so long and short communication and short twice. Means we will do too long, too communication, too short. For the next week would be long and communication only. I mean 3 long and 3 communication in the next week. Okay, so tomorrow we'll do short. Thank you everyone for the attendance. See you tomorrow inshallah with the short clinical station. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.